Hello, good day and welcome back to my channel. I will be introducing a topic today which I think I will spend a bit of time with because I think lots of people will find it very helpful. I'll be starting a series of talks on brachial plexus injuries in children. My name is Kemla and I'm an orthopedic surgeon, and this channel is dedicated to giving you information so that you can take the best decision for the health of your bones and your joints. Like I said, I'll be talking on brachial plexus injuries today. I'll be starting off just with a very brief overview because brachial plexus injuries are a big topic and we could probably spend the next 3 to 6 months just discussing the various aspects. I promise to just try and take up about 2 videos with this, and if you do have questions or you do have needs and anything you think I can be helpful with in terms of providing information or care, do feel free to reach out. Brachial plexus injuries are an important group of problems that we still see across the world, which can cause serious loss of function for the child or adult who is involved. What is the brachial plexus? The brachial plexus itself is a group of nerves that come all the way from your spinal cord and pass right through your neck and under your armpits in their bid to go to supply nerves to the whole of your upper limb. So your shoulder, your elbow, your wrists, and then your fingers and hand. Now, the brachial plexus is commonly damaged in children in specific situations that involve either a pull on the baby's arm. These are things that you would find during situations during delivery where the shoulders are stuck, so-called shoulder dystocia. Another time when you can find that would be times when the child is coming feet first, and in a bid to try to deliver the shoulders as well, there might be a bit of traction or pull on the shoulder with the arm extended, and these are things that could lead such a child to having brachial plexus injuries. Of course, one easy group of babies who are at risk of getting their shoulders stuck or having shoulder dystocia would be big babies. So this is something to be mindful of anytime you have a child who weighs more than 4 kilograms at the time of birth. Of course, now we are having a trend towards bigger and bigger babies worldwide, and I would imagine that we will see more situations with brachial plexus injuries if, these basic things are not kept in mind. Of course, there are situations as well where the mother has had to have either a vacuum delivery or she has had to have forceps delivery or some other form of manipulation because of a difficult birth. And these are all things that may cause the child to have some risk of a brachial plexus injury as well. How do we know that children have had a brachial plexus injury? Often they are fairly easy to pick up on. You would find a baby who has recently been born or not, depending on how quickly the signs are picked up, and you just find that this child is not able to move that upper limb as well as they are moving the other one. Now, fortunately, brachial plexus injuries rarely ever occur on both sides, because by the time one shoulder has been extracted, then this tends to provide a bit of room for the other shoulder as well to be delivered. Again, like I said, you would find a child who is not moving one upper limb as well as the other side. They may be uncomfortable when you try to pick them up or touch that particular affected limb. The reason for this is often we would have brachial plexus injuries occurring in addition to a broken bone, either of the collarbone or the arm bone in the child. Now, you would not expect a child of that age to easily have a broken bone. The reason for this being that babies have very malleable bones. So the bones are generally higher in organic matter, and so they are less likely to break cleanly and more likely to just bend. However, with significant force, you can still have a situation where a child of that age has had a broken bone. Of course, a broken bone makes it a bit more difficult for you to be able to assess the integrity of the brachial plexus in such children, and it would be the safe thing to do to continue reassessment for these children beyond the period it requires for the broken bones to heal. Fortunately, in babies who have just been born, in newborns, most fractures will heal in a period of about 2 weeks. At least heal enough for you to then be able to start the process of assessing the nerves and the muscle function. One other important thing that one should be mindful about is that while brachial plexus injuries are reasonably easy to pick up, there are different grades of severity of injury. And some of our assessment, certainly my assessment in my practice as a children's orthopedic surgeon, is to quickly stage the level of severity of injury that each child has suffered, because this then helps me to plan to see what may be required in terms of treatment and what the future probably holds in terms of function. There are injuries to the brachial plexus which may be incomplete. There are injuries which may be complete. Of course, an incomplete injury is much better. There are also injuries that occur to the nerves very near their direct exit from the spinal cord. These are called root avulsions, and they're very terrible injuries to have because they are almost essentially irreparable as far as medical science at this time is concerned. These are of course not so very common. There are injuries that can occur along the other lengths of the nerves. Sometimes they involve one portion of the nerves, the ones at the top. Sometimes they involve the portion of the nerves nearer the bottom, and sometimes they just involve all the nerves. And based on this, one may see a pattern of affectation that causes the child to be either unable to move the shoulder, or unable to move the elbow, or unable to move the wrist or the fingers, and sometimes the child is just unable to move anything at all. Like I said, the most important thing with brachial plexus is to pick up on any child who has a risk for this. So a difficult delivery, a big baby, a child who was born breech, a twin pregnancy, those sorts of situations, and to assess these children extra carefully, in addition to the general carefulness with which you assess all newborns, of course. The other thing is to present these children to the hospital to see your children's orthopedic surgeon at the earliest time. Reason for this is it is most crucial for us to start even right there to decide how bad the injury is, so that we can make a treatment plan together with the family. The other thing to be mindful of is that based on the severity of injuries, there may be different protocols and different levels of loss of function that may occur, particularly if the injuries are not seen on time. So if you do know anybody who has had a child who is unable to move one upper limb or the other, please stay tuned to this series, and I do hope that you will find information that will be helpful. I will be speaking on recognition of injuries, but more importantly on specific things that can be done for different patterns of problems that we see with children who have had brachial plexus injuries. Now, if you do know someone who is a much older child with a brachial plexus injury, all hope is not lost as well, because there are still specific things that may be done to improve the function of that arm so that the child can get the very best that they can out of their limb. Of course, as well, a lot of these children and families require decent psychological support, because there are important psychosocial aspects to brachial plexus injury, and to helping the child to be able to have a positive body image as well. Thank you, and please subscribe, share with your friends, and stay tuned for the next video, which will be talking in detail about specific aspects of brachial plexus injury management and care. Bye-bye.